Cancer. Cancer is abnormal, unregulated cell proliferation that competes with normal cells for things like oxygen, nutrients, and space. We may see it as neoplasms or tumors, where we have new growths of abnormal tissue. Cancer will be classified based on the tissue type, and that will be based on the origin. With carcinomas, we're going to see this in the epithelial cells. Lymphomas will be in organs that help fight infection. Leukemias are going to be found in the blood. Sarcomas are in connective tissue or bone or muscles. With growth, it can be either benign or malignant. Benign tumors compared to malignant are going to be non-invasive. They can still grow large, but they grow slowly, and they do not usually cause death unless it impairs function of a vital organ. We can also see metastasis, which is the development of a secondary tumor from the primary tumor. We can see it in the lymph nodes and blood vessels. Carcinogenesis is going to be the process of malignant transformation. And the steps that it follows initially is going to involve carcinogens that alter the genetic structure of the cell DNA. Promotion will be repeated exposure to carcinogens where the cells begin to produce mutant cell populations. And progression will invade adjacent tissues, and then it begins to metastasize. So the incidence of cancer, it is the second leading cause of death in the United States, and 1 in 2 men and 1 in 3 women will develop cancer at some point in their lives. The most common cancer is going to be lung cancer. With men, the prominent cancers will be prostate, lung, and colon. With women, it will be breast, lung, and colon. Genetics can have a factor. We're going to see damage to the DNA. We see mutated or damaged cells, oncogenes, and tumor suppressor genes. Contributing factors to cancers can be chemical agents such as tobacco and nicotine, exposure to asbestos, pesticides, and formaldehydes. The organs that are most affected by chemical agents are going to be the lungs, liver, and kidneys. Environmental factors will include exposure to sunlight, radiation, pollutants, electromagnetic fields, and nuclear power plants. Our diet can be a factor. Foods that are high in fat or nitrates, alcohol, or obesity are factors for cancers. Viruses and bacteria can also lead to cancers such as Kaposi sarcoma or the Helicobacter pylori. Different medications such as immunosuppressive drugs, hormone replacements, or anti-cancer drugs can be factors in cancer development. And a defective immune system that fails to recognize malignant cells, or they're not stimulated to fight cancer cells. These malignant cells will then survive and proliferate or grow. Excuse me. Signs and symptoms. The American Cancer Society in 2012 developed the mnemonic caution, where we have a change in bowel and bladder habits, an unhealing sore, unusual bleeding, a thickening lump, indigestion, an obvious change in the size of a wart or a mole, or a nagging cough. Other factors can include, or other symptoms can include headaches, weight loss, chronic pain, persistent fatigue, low-grade fever, and skin changes. Skin prevention or cancer prevention includes awareness of these warning signs and different factors of cancer development, cancer screening programs, periodic physical examinations. We need to emphasize and teach self-examinations, and breast, skin, and testicles are the main sites. Avoid risk factors, regular exercise, and a healthy diet. So question, a client has all of the following in his health history. Which would contribute most to the development of oral cancer? This is going to be D, chewing smokeless tobacco. So we diagnose cancer by looking at the client's history and doing a physical examination. Different lab tests would include tumor markers. We can look at proteins, antigens, hormones, genes, or enzymes that may be released by cancer cells. We can do a complete blood cell count, such as a CBC, looking for anemia, etc. We can do x-rays using a contrast medium or iodine or barium. A CT scan can look at the tumor density, size, volume, or location. We can do an MRI, nuclear imaging, where we inject radioactive nuclides into the blood, and that will help determine hot spots and cold spots. Do an ultrasound with the solid and cystic tumors of the abdomen, chest, breast, pelvis, and heart being observed. Or fluoroscopy, where we look at the movement of body structures, such as a barium study or a swallow. We can do a biopsy with frozen sections or cytology. We can also do endoscopy, which would include a gastroscopy, bronchoscopy, or colonoscopy. A nurse is conducting a skin assessment on a client. Which of the following characteristics of a mole on the skin warrants further evaluation by a healthcare provider? That would be your irregular shape. Remember your mnemonic for malignant melanoma: A, B, C, D, and E. Tumors are going to be staged and graded on the growth and cell type. The American Joint Committee on Cancer developed the Tnm Classification, where we look at tumor size, is there any lymph node involvement, and has it metastasized. So T for tumor, N for the node, and M for metastasis. Different stages include 0, where we have malignant cells that are confined. It has not metastasized. 1, 2, and 3, it has spread to lymph nodes or organs near that primary tumor. And 4, it's metastasized to other organs. Grading is based on differentiated tissue that closely resembles the tissue of origin, and undifferentiated, where it has little resemblance of tissue to the original tissue. And it will be graded from a 1 to a 4. Treatment of cancer includes 4 primary options. We have surgery, radiation, chemotherapy, and stem cell transplant. Surgery is going to be the primary method of diagnosing, staging, and treating. We can do a tumor excision where it is local or wide. We can debulk a tumor. We can do cytoreductive surgery. And if that tumor is contained, surgery is often curative. We can do a prophylactic or preventative surgery where we have a family history of a certain cancer type and the client elects to have that organ or tissue removed. We can do palliative, which helps relieve uncomfortable symptoms such as a paracentesis or a thoracentesis or nerve blocks. We can do reconstructive or plastic surgery that will correct any defects from the cancer itself. Mohs surgery is where we actually shave off layers of the skin. We can do a chemosurgery where we do a topical chemical application to the skin. Other surgeries may include a cryosurgery, electrosurgery, or laser surgery. Excuse me, then we move on to radiation, which will destroy cancer cells, shrink tumors, and relieve symptoms, ideally without permanently damaging healthy tissues. It can be external or internal radiation. Side effects will be alopecia or loss of hair, erythema, desquamation, stomatitis, xerostomia, that dry mouth, anorexia, nausea, cystitis, pneumonitis, and fatigue. It can also cause myelosuppression, depression of the bone marrow, so it's no longer producing blood cells, leukopenia, where we have a decreased white blood cell count, thrombocytopenia, where we have a decreased platelet count. We can also see fibrosis, which is often in the small intestine, lungs, bladder, cataracts. It can cause sterility or new cancers. Radiation safety is going to be determined by the length of exposure. These clients have to have a private room, especially if it's internal. Visitors with internal radiation have to maintain a distance of 6 feet. We're going to do shielding to provide radiation safety. Make sure that we appropriately dispose of contaminated articles such as gloves or gowns, body waste. Excuse me. Body waste can usually be flushed down the toilet, but we want to make sure that the client has a private bathroom. Chemotherapy involves anti-neoplastic agents that interfere with cellular function and reproduction to cure cancer, prevent metastasis, slow tumor growth, and destroy metastasized cells or relieve symptoms. Different drugs that interfere with RNA and DNA synthesis will include alkylating agents, nitrosoureas, topoisomerase 1, and antimetabolites. We can give this intravenously, usually through a PIC, Hickman, or implanted IV access device. It can be oral, intramuscular, subcutaneous, topical, intrathecal, or intraperitoneal. These cytotoxic antibodies are going to be used to treat solid tumors or blood malignancies. They cause hair loss, nausea, vomiting, and myelosuppression. Basically, what it's going to do is it's going to attack any fast-growing cells, and that includes hair loss, or the hair, and our blood cells. They're fast-growing. in addition to some of the lining of our structures like the GI tract. Uh, it can interact with many drugs that cause drug toxicities. Some of these drugs may be the doxorubicin or mitoxantrone. Once again, the chemotherapy side effects: nausea, vomiting, stomatitis, alopecia, myelosuppression, and fatigue. And then stem cell transplant replaces bone marrow that's been destroyed by cancer or cancer treatments. And it's done through a process called engraftment, where stem cells develop into healthy blood cells and then begin producing new blood cells. It can be autologous, which removes the client's stem cells. They're frozen and then reinfused. Allogenic will be donor stem cells. We can see the graft versus host disease, where the transfused cells will then begin to attack the client's cells. Immunosuppressant drugs can help prevent this graft versus host disease. And a mini transplant would be another option. Syngeneic stem cell transplant would be from an identical twin that has identical tissue types. This will avoid the graft versus host disease. Prior to transplant, the client will undergo intensive chemotherapy and maybe radiation, which can cause many side effects, and clients are going to be at a high risk for infection and bleeding. Another treatment for cancer would be our targeted therapies, where we use the client's own immune system, or clients receive immune system components that help the body's natural defenses fight against these cancer cells. These would include some of our biologic response modifiers, our nonspecific biologic response modifiers such as cytokines, interferons, or interleukins, monoclonal antibody immunotherapies, cancer vaccines. There's some clinical trials going on for that. Hyperthermia uses high temperatures to destroy tumor cells. Photodynamic therapy will administer photoactive drugs that concentrate in malignant cells, and these cells are then targeted by laser light to destroy malignant cells. Gene therapy is still an investigational therapy that will replace mutated genes with correct genes or introduce substances that destroy cancer cells. New clinical trials are constantly being introduced and explored. And complementary and alternative therapies are often used in conjunction with cancer therapies, but clients do require appropriate education with these. So, question. A client has frequent nausea and vomiting following radiation to the abdomen. An appropriate intervention for the nurse to use would be this is B, monitor fluid intake and output. So nursing management of cancer clients can be very challenging. We need to monitor for gout, which is that increased uric acid level, joint pain, and edema. Dietary modifications, they may require small, frequent meals. Increase their fluid intake from to 2,500 to 3,000 mLs a day. Report excessive weight loss or changes in the level of consciousness, paresthesias. Encourage protein and calorie intake. Plan their care around their energy levels. Encourage a sufficient intake of calories. Excuse me. administer antiemetics as ordered prior to meals, explore their strengths and resources, and provide client education on infection control and when to contact the healthcare provider. And care of that terminally ill client can be also very challenging because it can just be difficult to put yourself in that position of taking care of someone that you know is currently dying. So gently carry out tasks to reduce pain or discomfort, control their pain, provide adequate fluid and nutrition, keep them warm and dry, control odors, and maintain their dignity.